As stated by the source of Frontiers in Public Health, Turner et al. Discussed the types of economic models used for making informed policy decisions and resource allocation in healthcare. Economic considerations that are gained in a prominent role include planning, management, and evaluation of health systems. Health economic analysis can be used to assess health interventions that are valuable for money and could support optimal allocation of resources that depend on availability. Full economic evaluations are a type of health economic analysis that compares both the costs and consequences of two or more alternatives, including a comparator. Even when focusing on a single intervention, a full evaluation implicitly or explicitly compares it against at least one alternative course of action. In contrast, partial economic evaluations do not compare alternatives or do not consider both costs and outcomes simultaneously. While they can provide useful information, such as the cost of an intervention or the burden of disease, they cannot independently guide resource allocation decisions because they do not assess value relative to other options. Five types of economic models to be analyzed are cost effectiveness, utility, benefit, minimization, and consequence. Cost benefit is the comparative analysis of relative costs and two or more outcomes that are the alternative courses of action, where all costs of an intervention and its results are expressed in monetary terms. For example, this economic evaluation approach was referred to as the gold standard. This analysis is commonly summarized to estimate net benefits of an intervention or by its ratio. Another outcome measurement that can be used is the internal rate of return. It involves the summing values of costs and benefits of those affected based on the preferences. Other expressions in monetary terms include return and social return of investment analysis. Cost effectiveness and utility is also the comparative analysis of relative costs that pertain to two or more outcomes. To use an analogy, cost effectiveness is the measurement of an intervention in a single natural unit of health consequences, and cost utility is the generic measurement that is dependent on health status, which can account for reductions in morbidity and mortality. Cost minimization is all that is assumed to have equivalent health effects. cost consequences is the evaluation of two or more policy alternatives in terms of relative costs and outcomes, where outcomes are not summarized in a single measure and multiple outcomes are reported. The top three models that are most appropriate for economic evaluation and cost analysis include the benefit, effectiveness, and utility. Mobasheri et al. Discussed addressing mental health literacy and depression for people with the disease. A mental health action plan was envisioned by the World Health Organization based on the accessibility of high quality, culturally appropriate, adequate community-based mental health care that was developed as an integration. Mental health is a key focus area within many national health programs, which often prioritize conditions such as schizophrenia and epilepsy due to their high burden and need for long-term care. With the ongoing plans and measures for upscaling mental health services and psychological interventions, it reinforced the COVID-19 pandemic. The government plans to implement health care so future global health risks can improve preparation. The population's concept of mental health can inform and improve awareness campaigns during the change and development of a mental health care system in Vietnam. Schizophrenia and depression are the two disorders that describe mental illnesses.